This is a program that started before the FDA had approved Radium-223, but after the phase 3 Alcimca results were available. And it was an opportunity for people to be able to access radium before the FDA approved it. It followed the FDA label. These are metastatic, symptomatic, castration-resistant prostate cancer patients with no visceral metastases. 180 people were treated, and really the important question is, what did we learn? So the first thing that we learned is that there were no new safety signals. There was nothing else to really be concerned about. That everything that we saw in Alcimca was pretty much true here. There's a tiny amount of thrombocytopenia, but the truth is that most people tolerated the drug very, very well. Second thing we learned was new, and that is that we could give concomitantly abiraterone and enzalutamide with radium and found total safety, no issues at all, no problems at all. We didn't know that from Alcimca, the phase 3, because, as it turned out, Abi and Enza were not available during the Alcimca trials. Next thing we learned is that people who had both abiraterone and enzalutamide before they got the radium really did not do very well, and they were not able to receive very many cycles of radium. There were a couple of prognostic factors in the multivariate analysis. Number one is prior Abi and prior Enza together, then going on to radium, resulted in very few of the patients being able to get the appropriate number of cycles, which is 6 in the FDA-approved label. We also found out that if you don't get 6 cycles, you turn out to have a very poor prognosis. What we did is we looked at those individuals who had 1 to 4 cycles of radium versus 5 to 6 cycles of radium, and there's a profound difference. If you got only 1 to 4 cycles of radium in this group of patients, the median survival was only 7.5 months. That was compared to, if you got 5 to 6, we didn't even reach the median survival, so it's going to be longer than 17 or 18. What I can say is radium ought to be given to people who can get 5 to 6 cycles minimum. And that probably means not waiting until both abiraterone and enzalutamide have failed. We need to bring it earlier into the treatment sequence.